Hi, I'm Dana Opelman. Welcome to this week's video. Today I want to give you some tips for dealing with illness. Now I know if you've worked really hard to get your baby sleeping well and then she gets ill, it can be a little nerve-wracking. So I want to give you a few things to do. Number one is don't move your baby, right? If she's very sick, sometimes babies get very ill and you're worried about them through the night, it's much better if you go to baby than if you bring baby to you. So even if that means you throw down a mattress on her floor for a couple of nights just so you can keep an eye on her, that is much less disruptive than bringing baby into your bed. That is hands down the biggest mistake people make. The second tip is to be careful about regressing back into props, right? If you've worked really hard to break the association between breastfeeding and sleep, then you want to be really cautious that you don't reintroduce the prop by feeding your baby again in the night. Now, if the doctor has recommended that you please give the baby a nighttime feed, maybe she's getting a bit dehydrated, whatever the recommendation is, you should obviously follow that. But anything you do 3 nights or more has the potential to be habit forming once again. So one night, probably not the end of the world. She will most likely go back to sleeping well once the illness is over, but a couple of nights, 2 or 3, then you're just in a bit of a slippery slope. So really monitor that quite closely. If there's been no suggestion that you do that, then please don't, right? There's no real reason why a sick baby would need a nighttime feed all of a sudden when they've been doing well without one for weeks or months. Also too with rocking. Now, you can absolutely increase your comfort level, and that would be tip number 3. Go ahead and increase your comfort level. If people are sick, babies are sick, we tend to need a little more reassurance and comfort. So totally fine to go into the room, take baby out of the crib, have a short cuddle, wipe the nose, give a drink of water, more Tylenol, whatever it is that's going to provide a little bit of relief for your sick baby. But then put the baby back in the crib before she's asleep again. Now the good news is, if you've got a child who has great sleep skills, she's not really going to want you to mess around with them too much. I had a son, my second son had about a year-long ear infection, it seemed like. And obviously he would need some comfort in the night. We'd have a bit of a cuddle in the rocker, but then he would be very clear about wanting to go back to his crib when he was ready. If I had tried to rock him to sleep, he would have, had nothing to do with that. He'd be wondering, what is this woman doing? So comfort is fine, just don't interfere with the props. And once the illness is over, there might be just a little bit of a regression. If you've given a little bit of extra comfort and you've maybe blurred the lines a little bit about what your expectations are around their sleep, you might find that when the illness is resolved, that you have to spend a night or two kind of reinstating the rules and getting baby back on track. Now, if it all fell apart and you did bring baby to bed and you did feed again and you're back into prop dependency, then that's, that happens, life happens. And all you would do is get back onto the program, do 2 nights, 2 nights, 2 nights and out, knowing that your baby absolutely can do this. She lost her way a little bit, but if you just help her get back on track, within a few nights you'll have her sleeping well again. Thanks so much for watching. Sleep well.